session. So I'm sure since these 2 days you are discussing a lot about the systematic review. So let me introduce myself first. I'm Buna Bhandari, as already mentioned. So now currently I'm based in Nepal. I'm working as a faculty of epidemiology in the Center Department of Public Health, Tribhuvan University Institute of Medicine, Nepal. And I'm also working as a law scholar as a Department of Global Health in Harvard University. So apart from that, I'm affiliated with Author Aid for around a decade as an author steward and INAS associate as well. So through this connection, I'm here to talk about systematic review and topic, developing a systematic review topic and research questions. So, I mean, it's great to see, okay, I can't see. Okay. See lots of participants, so it would be great to have an interactive session, but due to this virtual mode and time constraints, I'm directly going to start my talk on it. So, but feel free to unmute yourself and ask the question, and we'll have a question and answer session at the end as well. So, systematic review is, I think you all are aware about it after these 2 day sessions. It is a rigorous and organized process where we try to synthesize the evidence which is already available in the literature. So it is a systematic process. So for that, we have to identify the appropriate literature and appraise those all the available literature based on the specific research question. So that is the most important things, our research questions, because that's what we are going to discuss in this 1 hour. If we don't have good research questions, then we can't draw conclusive evidence for our review, or at the end of the review, our main aim is to have some evidence on a particular topic. So we have to be very careful while selecting our topic and while designing our research questions, which will guide the process. Therefore, let's talk about it. So I'm sure you know this evidence hierarchy of evidence chart. So in the top, there is a meta-analysis and systematic review, which provide the strongest evidence to inform the policy and for future studies as well. But having said that, if the review is not conducted well, or the topic is not identified or designed in appropriate way, and the question is not strong enough, then we can't just say like the meta-analysis and systematic review would provide the strongest evidence. So therefore, this is a very crucial stage in the process of the systematic review. So this flow diagram is proposed by the Cochrane review team. So first, while conducting the systematic review, you should have, when you decide the area where you want to do the study or which area you are going to conduct the systematic review, then the research questions comes first, as I already mentioned that. So then after having a clear research questions, other process will follow. It will inform our methods of review, search strategies, inclusion exclusion criteria, and everything. So let's first discuss about how we can generate the idea about the systematic review, or how we can decide like which area is very important to do a systematic review or not important, or in the broad area as well, like where to go. So in research, like other research also we talk about, we usually try to find the gap in the literature and conduct the study. In systematic review as well, we are trying to, there are the multiple already, there would be the individual studies, the original studies, and through the systematic review, our main aim would be bridging the gap between the research and the practice, means the policy, for informing the policy. So how we can identify those gaps and how we can design our systematic review topic. Let's talk on that. So it is this identifying the systematic review topic is first step while designing the proposal, and it is not an easy task. I mean, yes, there would be because I heard, because I'm um, talking about systematic review and conducting and providing training in lots of different forum, and people or student usually come to me and say, oh, I want to learn about the systematic review, so I just want to do the systematic review. So they come up with the methods, not the idea, so we should have a idea first, the research area. So systematic review is a method to implement or to examine or explore the area where there is a gap. So it's not like we decided the method systematic review and meta-analysis and we want to do the systematic review. It's not go like that. It's like there should be gap in the literature, or there should be the need of doing the systematic review, which demand there are the multiple studies, or there is not concrete evidence in because different literature, if there are different literature, available literature, and all the literature has a different opinion or similar opinion. So if you want to have a concrete evidence, then you should think of doing the systematic review. And so how means yes, of course, as I already mentioned, like the literature review is the most important things. And apart from that, or along with the literature review, consultation with the academics or the professional, which like of the related field expert consultation is the prime, because while deciding the systematic review topic and designing the research question, it would take time, and also we need to engage the related stakeholder. I mean, who are working in the particular area where you are going to do the systematic review. So that should be the process of selecting or the identifying the gap as well. So in literature review, so sometimes people might confuse with the like systematic review and the literature review. Yes, systematic review is also informed by the literature review. So we can't just go and do the systematic review. So while doing the literature review in particular topic, we should see about, like, first you should know what is the area of research you want to do, and what is known in that area, what is the already evidence are available in that field, and what is not known in this area, means like the what is it to explore for that particular area. And also which unknown, because sometimes there might be lots of unknowns, lots of gaps, so we cannot do we cannot address all the questions at the same time or by a single review sometime. So in that unknown area as well, where we want to focus our research or our review, that we should decide as a team. So to know all these things, we should have extensive literature search first, and then only we can identify the gaps, means what is unknown in that area is a gap in the literature, means that still need to be explored. So sometimes unknown means it should not be like a novel or other people have not done it, but if there is no concrete evidence on that particular area, then we can think of doing the systematic review, and we can design our topic as well. So when you know the gap, or then you have to also know why it is important to address that particular gap. What happens if we do not do that systematic review now, or that gap is not addressed, and what contribution, mostly because in the beginning also I mentioned, usually systematic review will try to provide some evidence, or to inform some practice or policies. So what contribution will it make? So because those kind of initial questions or the thoughts should be there while doing the review. And also sometime you should think about like if it is relevant. I mean, it is not the prime focus in the beginning, like whether it is interested to the journal or not, but sometime in the beginning also you want to explore like what are the outlet target journal would be of your area, And another most important thing is whether the research team has the knowledge, expertise, and all the other resources required for conduct the systematic review or not. Because we know the gap, we want to do the study, and we are very passionate about that. But if we do not have the knowledge, expertise, then we might not able to justify those things. That's why I think this kind of training is very helpful in capacity building and enhancing the knowledge and skill in this area. So that is also very important consideration while conducting the systematic review. So like other research problem in systematic review, and the research systematic review topic and research questions should have the finer approach, or should fit within this approach. So feasible means, as I already mentioned, there should be the adequate expertise and the capability of the research team in to answer those questions. And it should be, in this case, in systematic review, we are concerned about not the number of the subject, but the number of the paper. Sometimes you want to do the study, you want to, for example, if you want to do the study about, like, I'm giving example of related to my area. So please, don't mind if you don't understand. Like, if you want to study like the effectiveness of mobile health service in improving the health status of the hypertensive patient. So if you want to do the systematic review in that area, and at the end you have everything, but if you do not find any study which already done and published in that topic, then your review would not be complete, and your time, energy, everything would be wasted. So while doing the preliminary research, you should also have the tentative. You won't know the numbers, like how many papers you will get, how many will not, but you should have some idea, like at least 2, 3, 5 paper you will get during searching that article. So that also should be decided, or should have in mind while deciding the research topic and the question. And it's time, because time and energy, because based on my experience, at least 1 year is needed to complete a good systematic review. Yes, there are some rapid review. If you have the motivated team and time and energy, you can do earlier than that as well. But don't think of doing the systematic review within 2 months, within 3 months, because this process would take time. You have to have a source strategy, searching in the database, and the finalizing those source strategies and everything, and reviewing all the articles. So it takes time. Like, at least in my case, I haven't finished any, like in our team, because for systematic review, we can't say I, because the team would be needed. So at least a year would be needed. So that kind of feasibility should be scoped in beforehand. And of course, interesting to the investigator, because it is a time consuming, and you have to go back and forth, like go through the lots of studies, and sometimes to come to the conclusion also, like the lots of consultation, expertise, and opinion is needed. So if you are not interested in those areas, then it is a little bit challenging. I'm not saying like don't do when you are not interested, but yes, interest help. And novelty, like already we mentioned, like your review topic can confirm or refute the previous finding, or extend the previous finding, or sometimes provide the new findings. So while doing the review, you want to address the gap in the knowledge. So you don't want to overlap what is already there, or unrelevant topics. So as I said, you can do the review if there is already a review, but this should be there, whether your review would add something to the previous finding or something like that. So of course, some novelty would be there. Ethical, it is for all the research, and relevant, of course, like to your topic should be relevant to the scientific knowledge, policies, or research, future research direction as well. Sometimes though systematic review could not inform the policy directly, but sometimes it can say, okay, there is no concrete evidence in this particular area, so those kinds of research should be done in future. So that kind of future research direction also can give. So to make the relevant, really to improve the relevancy of your systematic review, ideally involving the stakeholder in while designing the question or while selecting the research topic, review topic would be very helpful. And at the end, um, um, after completing the review, translating this finding into the policy also would be very helpful to make it relevant. So after you identify the gap and identify the area where you want to do, like the broad area, topic would be the broader area, like where you want to do the systematic review, then we should develop the research questions. What research questions we are going to address through the particular systematic review. So everybody know that, like, research questions, like other review, other research questions, it should be clear and specific, because sometimes if the question is not clear, then our method, our analysis, and like all the process, there would be the confusion, or there would not be the clarity in the evidence generation. So therefore we should try to develop the clear research question of the systematic review. And actually, I mean, it is like other research, like it would be developed in a question format, and but this question should also based on the identified gap. That's why I focus on the gap since beginning of the talk, means what gap we are trying to understand and what evidence we have, we want to provide. So our research questions also should based on that. And then it should concisely present the gap and what answer you want to get at the end of your review. So that should be defined. So in systematic review, like in any research, like any research, in systematic review as well, like well developed and answerable questions is the main basis, foundation of the review. So this should be very specific, and it would help in understanding the specific in-depth answer of certain problems with the systematic approach. And I don't know, like we should take a question in between or not, like because it seems like one way. So please raise your hand or ask a question in between as well if there is a confusion. I don't want to like continue like as a one way. Otherwise, I would continue. So this is, I've already mentioned the well formulated research. Is there any question?
Yes, please.
Okay. Please go ahead.
Thank you very much. My question is about the gap, the research gap that we should be considering. My question is about the research gap that we should be considering for our studies. Sometimes we do read the literature, and some topics are really, really rare. I'll give an example of a field like monitoring and evaluation. So you're doing research about monitoring and evaluation, and you find, because it's a very practical issue, you find that what I've found mostly is that NGOs have a lot of data about practice and, you know, some general practice issues that you'd be interested in understanding. but less of that is documented in academic literature. Would that be a good justification for someone to suggest an academic study to fill the academic gap? Because, like, if there are no, or there are very limited numbers of published papers about a topic, but there is lots of information about that topic in, maybe I should call it gray literature. I don't know if that would be good, gray literature. So would that be a good justification for someone to go ahead and document whatever is out there and, you know, continue to study about it just because it hasn't been documented in academic terms? Thank you very much.
Yeah. Thank you, Marky. Sorry if I pronounce your name correctly. It's very important question, and you raise an important issue, because sometimes there are in practice we have, you know, sometimes in our everyday work or other work like program implementation, we have a data, but that has not been scientifically done as a research or published. So it is very difficult to say like this is available in the literature or not. So in this case, what I would suggest is, yes, that is a gap, but rather than going directly into the systematic review, the gray literature search and scoping of the evidence would mostly addressed by the scoping review, because in scoping review you would have a broad aim, broad research question, where you would just see what are the available literature there, even the unpublished data, gray literature, as you mentioned already. So unpublished or other source of the data, so that we can scope, and based on the scoping review, we can develop the next step would be a systematic review. Yes, and one more thing is, for the if there is a data like unpublished or other data available, but if it is not published, then we cannot include those evidence in the systematic review. Either we have to do the data systematic, like the secondary data analysis, and publish the research based on that, or the scoping review with the gray literature. And gap in the literature, I would say, I mean, as I mentioned already, for the feasibility, like the finer approach, it is, if there is no evidence, no available studies, then you would not find the, you would not find studies to be included in your study. So here, I would say it is a gap of the studies, not the evidences. So I think that gap might or might not justify the systematic review. Why is I'm worried more about here getting the enough studies to be included in your systematic review. There are, if there is no studies available, then that is the gap of the research, not the knowledge gap. So we have to do the research on that area. So that gap could be doing the primary studies or secondary data analysis. But here in systematic review, what we trying to see the gap is, there are already available literature, lots of literature are available, but they have not answer, or like the conclusive evidence is not there, or this area, some area, particular area is not answered well, or the synthesization is not done. So it's more about the synthesizing the already available evidence. So I hope I address your question, but we can again discuss on this. Thank you so much. So should I continue? Okay. So I'm going to continue, but we can discuss at the end as well, or in between as well. So yeah, well, if the research questions is well formulated, then that based on that research question, we can determine the eligibility criteria of the studies and search strategies. So what are the search strategies? Because search strategies are very key in the systematic review. If you do not have the comprehensive search strategy, then you might miss the important study, or you might get lots of unrelated study we will get. But if the search strategy is not good, then the quality of the systematic review also would be compromised. That's why, and also what are the data we need from those included study, and what kind of finding analysis we do, and how we present. So these all aspects would be informed by the well-formulated research questions. So usually while developing the research question, there would be the broad topic, means area, like, okay, nutrition among children or something like that. And you can narrow down like among the children of under 5 children or something like that. And among nutrition also, what area you can, so from the broad, you can go to the concise, and your research questions would be specific on that particular topics, what you want to address through the systematic review. So usually in systematic review, the questions can address, like, if you are interested in, sorry if I'm giving more example from the health related field, because I belong to the public health, and I'm sure there is a diverse group of people in this forum. But yeah, let's try to fit within your area as well. So if your research questions, if you are interested in how to select the diagnostic, then the research question would focus on the diagnostic aspect, or the intervention, how to select the treatment, or to offer the patient, I mean, in a cost-effective way, or in a feasible way. So that can be also like a intervention or therapy, if you want to do on that way. Or if you want to do the prediction or prognosis, like the how to estimate the patient likely clinical course over time, or anticipate the complication of the disease, like what course of how the course of disease will develop, so, or the cause of the disease. So depend on what kind of which area you want to focus. So apart from this, like, other could be the perception or the experience of the people, like or behavior or any kind. So that kind of approach will determine your research question, and what design of the what type of design will address those questions. So that would relate it from that. So let's see some of the examples. I think in the next slide I have some example about that as well. So therefore we have to engage, we should engage with the research team from the beginning, because there would be the sometime there would be a complex issue, like whether you want to focus on the intervention design, or in the diagnosis, or the experiences, or some other, I mean, you know, the area, but in that area of the researchers where you want to go. So we should discuss among the research team vigorously since the beginning, or while deciding the research questions, like which research questions is most important to answer at this stage, if there are many, and how to engage with the stakeholder in formulation of the research question. And in the review process also, sometimes we have to modify this aspect as well. So, and also how broad or narrow review we want to do. So our research question also should form accordingly. Usually some of the systematic review have one broad and some specific questions as well. So I mean, as a reviewer, the team can decide where and which area we want to focus on. So for the systematic review, there are different framework available for addressing the research question or developing the research questions. So it is good to use those framework based on what area or which design you want to use. And it will this framework will have the different concepts. So if you use those framework, this research question will address some different concept. For example, in medical research, medical research and clinical research, PICO framework is very commonly used. And I mean, if we are doing the studies about systematic review on the intervention, I mean, I hope like everyone would understand the intervention means some kind of program or something which we are the studies try to implement in some situation. Then if we want to see review about those finding, then we will mostly use the PICO model in clinical research. So in PICO concept, but there are other concepts. If you are doing the studies like other quantitative or mixed method studies or qualitative studies, usually this sorry PICO concept is used in the intervention studies or the randomized control trial or other quasi-experimental or pre-post study as well, where we are using some of the intervention. So, but if you are doing the reviews of the just the qualitative studies or mixed method studies, then there are other framework as well. So in PICO, mostly we focus on the 4 aspects. So first is the this P stand for the population. So which population of we are interested doing the study, whether it is the children, adults, or the woman of some particular age or something other population. So that also should be specified in your research question. And what are the intervention means, what kind of whether it is the vaccines, whether it is the drugs, or whether it is other health education or anything. So that should be also included in your research question. And what are the outcome of interest, so what you want to see at the end of the study. So and what studies design are appropriate, also we should think about that. So if it is an intervention study, then your question can focus, does the intervention work or not, or who does the intervention work? I mean, sometimes some intervention, like for the vaccine as well, like some vaccine are safe in particular age group, some not. So that if we are interested in those group, then how does the intervention work, or is the intervention appropriate or feasible in terms of cost and all the, or the is there any comparison or not? So those questions of interest also should be addressed. Usually in the PICO format, we try to include all those. Sorry, my throat is okay. If there is, let's take some break. If there is any question at this stage, please go ahead and ask. Any questions or confusion? Okay, if not, I'll continue. So this PICO approach in the review, we have to review this PICO. Okay, I see the hand. Okay, go ahead. Dr. Edekun, sorry, please, yeah, can you ask your question? I can see your hand.
Hello. Thank you so much. Can you hear me? Can you hear me clearly?
Yes, I can.
You hear me? Yeah,
Yes,
thank you.
yeah.
See, for the framework, I'm just inquisitive, because I know that for scoping review, most times we use PCC, you know, the population, the content, and the context. You understand?
Context,
So
yeah.
I'm saying, can we equally use this framework to design our question when we're talking about systematic review?
Yeah, okay. Thank you. So yes, in scoping review, is our questions, as I mentioned before as well, we are trying to have a like the broad context. So usually PCC approach would be used, but in the systematic review, I will talk later. There are other framework apart from the PICO. So those, if there is a qualitative study at that context, we can use those kind of framework as well. So usually in the scoping review, we are trying to scope all the available literature and where the study is done, what is done, and what are the contexts. So if it is not an intervention, even in the systematic review, we can use those kind of framework, but maybe at the end, there would be some clarity, because I'm going to talk about the what kind of framework we can use in the qualitative study and in the mixed method study, because usually this PICO framework comes for the intervention studies. Like if you are interested in answering some question related to the intervention. So if there is no intervention, then it would like I would not be there. So I mean, we can use those kind of concept in other design. But if you are looking at the intervention, maybe the PCC only does not fit. If so, depends on your framework, your research question, you will design the research question accordingly. Okay, I hope I could answer your question. Or let's wait at the end and we can again discuss on this. So in the PICO, if you are trying to see the review some intervention, then this PICO framework you should have you should review at the protocol stage. It means based on that you will decide the what are the which studies will be eligible in your study, or what will be included, what will be excluded. Because if you are interested in the intervention study, then your other design would be like excluded. So that also this PICO framework would help in the beginning. And at the synthesis is like evidence synthesis state in the like the what are the evidence you need. I mean, like which group intervention, which comparable group, and what are the outcome you want to synthesize from the included studies. That also you can plan during the protocol stage. And of course at the review stage also you will review your PICO and see the included study, whether that have actually investigated all the included studies had included this PICO or not. So, okay, maybe this example would clarify better. So if your research question, like your research question, this research question, if you are doing the study among the cancer patients and I want to see the quality of life, like what is the quality of life of the cancer patient after having some educational intervention or after some intervention. So in this case, your population, the P would be the woman with the breast cancer, and intervention is the education, and comparison is the who, like the same population without who are not taking those intervention, and outcome is the quality of life. So those PICOs should be addressed in your research questions, or sometime, you know, context those things even in our topic, like we can address. So what is the effectiveness? So we want to see the effectiveness like of the educational intervention, like intervention in improving the quality of life, means that is our outcome among the women with the breast cancer. So that is how you should form your research question. So it is specific. We are clear about the, if you say only the effectiveness, sometimes it will not be clear. So if effectiveness in terms of what, like recovery or sort other symptoms like the comorbidity, or so that here we are clear about the, we have specified that the quality of life. So that kind of approach, I mean, so if we make our research question like this, then you will develop your search strategies, or your included study also should include those things. So if there is a study where they have done the study about the quality of life among the cancer patient, but have not specified about the woman with breast cancer, then that study would be excluded. So that's how like this research question and PICO framework would inform our review process as well. And there are, as already mentioned, there are around at least more than 25 other framework apart from the PICO. So based on your objectives, you can decide which framework or what you want, where or what you want to study, like PEO, Spider, Spice, Eclipse. So that all framework can help to design the research question. So let's see, like if as you already mentioned, PCC, like that, like the here we are not interested in looking at the intervention or what are the program or what that does. We are just trying to see the we are trying to review the quality of life among depressive adults. So here the population is adults, so exposure. So PEO means population, exposure, and outcome. So outcome is we want to see the quality of life among depressive patient. So our exposure is a depression here. It's not an outcome, because we are trying to see among the depressive patient, and outcome is the quality of life. So what is the quality of life of adults with depression? And this framework usually in the quality, this kind of study like would be done by the qualitative study. So if you are doing the systematic review of such, with using such kind of research question, then you will know the what type of design of the study should be eligible to be included in your study. And like that, like in Spider framework, that is also the 5 concept, like sample, phenomena of interest, design, evaluation, and research type. So yes, sample, I mean somehow the sample or population is all the approach talks about your study population. So here the mothers, and the phenomena interest in what you want to study, like immunization classes, and the design, what kind of research design is used, and what is the outcome you want to see, means experiences. And the research type, usually this Spider framework is used for the doing the mixed method systematic review. So where we will include the qualitative and quantitative, both the studies, and we'll do the review both. Even in the systematic review, we can do the quantitative analysis and the qualitative synthesis as well. So I mean, as a reviewer, after identifying the gap, review team, I would not say one individual, review team should decide like what is our interest, where we want to study or explore more. So what is needed, so that can be decided in the beginning, and accordingly this can be designed. So there are other like SPICE. So this is also mostly focused either like setting, prospective, intervention, comparison, and evaluation. Like in this, if you are using the, okay, I can see the hands of Nafisa. Yes, Nafisa, please go ahead. Nafisa, do you have question? I can.
Sorry, I wasn't able to unmute. Hi, Dr. Buna. Thank you.
No.
My question in the first framework, PICO, and the example that you gave about the effectiveness of health education improving quality of life. In the intervention, you mentioned education. What about for example, in education, which the method of education, for example, is like workshop or group discussion or etc., whatever. Can it be determined in the inclusion and exclusion criteria? I mean, for example, if I'm targeting all the studies that, for example, use the method of education like only lecture and workshop. should I report that in the inclusion and exclusion criteria that I'm just including these studies and I'm excluding the others?
Yeah. Okay. Thank you, Nafisa. It's very like the important question. Yes, you already answered the question as well. I mean, either sometime, I mean, if you are just, you want to go at, okay, education to the training or workshop, if you want to specify, you can. But ideally, what we do is, like, you have the education intervention, and in your inclusion and exclusion criteria, you will specify what kind of education or what mode of intervention. Like, for example, if I have to give, like, I usually study the digital health intervention among in the non-communicable disease. So that would be my focus. So usually sometime if I, in my topic, like if I say digital effectiveness of digital health intervention in improving such, but in my inclusion and exclusion, I'm doing currently one, so I can give that example. So what I did is, like, so intervention through the text message, phone call, or something like that, but not the app-based intervention. Because why? Because sometimes, I mean, those inclusion and exclusion also you have to decide based on the some rationale. Like, if I'm doing those studies in the LMIC setting, and if I think that I'm just interested in that low cost intervention, not the you know, which need the sophisticated mobiles like smartphones and other things, so that cannot be implemented in my setting. So if I want to go with the simple phone and text messages, like phone call and text messages, so in that case, I want to exclude those kind of methods of intervention delivery. So it is the method of intervention delivery. But yes, you can write the include like the some method you can exclude, but you should have a justification for that as well. I mean, sometime reviewer, or sometime why you are excluding the workshop and why you are including the training. And if you are interested only in training, as I mentioned before, like I just exclude the app-based intervention, but only SMS and phone call, then I have a justification, like I'm trying to look at the LMIC setting with the low cost intervention. And so that kind of, you know, like the based on your research, you can have a different opinion or different rationale. But yes, that is the answer for that. Okay, thank you, Nafisa, for agreeing with my comment. And Temito, yes, please unmute yourself.
Thank you for the presentation. It's very is an eye-opening, and is very helpful. But I want to ask, why can't we use Eclipse for quantitative study? In fact, looking at the example you pose here, because I'm actually working on a project that has to do with the acceptance and understanding of tele-health care, especially telemental health initiative in psychiatric setting. And I'm looking at Eclipse with all these characteristics. I see that it can also fit into quantitative study, but I just want to clarify, because it is rare that it is for qualitative research topics. So I want to know, can it also be used for quantitative study?
Okay. Yes. Let's discuss. Thank you for the questions. So let's discuss this, and I will come to your because I have just started about the Eclipse, but very good remarks from you about the Eclipse. So usually why we want to use the qualitative studies. So that is the term, like why sometimes we want to quantify the evidence, you know, like so here we are talking about the expectation, you know. So sometimes expectation cannot be quantified. Sometimes, you know, like you can those kind of expectation can only be answered through the qualitative. But of course, sometimes like the qualitative aspect can be quantified as well. So usually this kind of like how can access to telemedicine be increased for rural patients in this case, you know, like so we are trying to the how, not the what and which, because that the you know, quantitative design or the question will try to address more. So, so
Mm.
our research question focus on how can we address, so that how answer sometime, I'm not saying like 100%, but effectively how and why can mostly address with the qualitative. So that's why. So, but if you, I mean, there is no hard and fast. I mean, I am not 100%. I can't say like you can't use for the quantitative. So if your quantitative research questions fits within this Eclipse framework, then you can use. But because there is no hard and fast rule, like I can't say no. But if your research questions is more prone to the how or expectation of the client or the experiences or the perspective, so in that case,
Work.
it is difficult to address by the quantitative studies. Yeah. Hope it would clarify. Yeah, but it is very good questions.
Yes. Thank you.
Yeah. Thank you. So, okay. So these are the framework I was mostly like the talking about for the, there are others, as I mentioned before, like there are other 25 frameworks. So you can, I think this slide are available. So there are other 25 framework, but what based on my experience, so I'm going to share now example of some of my studies, like which framework I use in my studies, in my systematic review. So if you are using like the familiar with the 2-3 framework, with like one with the intervention, one with the qualitative, one with the mixed methods, then that would be fine. You know, like you don't have to have expertise of all the framework, but sometimes of course you should know, like if you only know the PICO and you want to do the qualitative synthesis or mixed method synthesis, at that time this PICO does not fit. So that's why like other framework is also, understanding other framework is also very important. But I would say it's not compulsory to know all the framework or all the methods in the beginning, based on my experience. So don't worry about like all these things. But when your research, when your objective demands, you should go through this. And sometime in systematic review, you, based on my experience, I learned a lot after doing the review, like not from this theoretical class and other workshop and training, will know the process or the theoretical concept. But sometime while doing systematic review by yourself, it would be more helpful in understanding the concept, that what I understood based on my experience. So I'm going to share some of the research questions. I'm not sure about the time, I mean how much time I'm taking. So yeah, I'm going to finish soon. So this is the one of the study, like it is recently published in Advances in Nutrition, like it is a very good journal of nutrition science. So where we see we were interested on looking at the long-term consumption of different food groups on cardiovascular mortality. That's why like here you can see like that there is a design of the studies also already included, like the cohort studies, because if we talk about the long term, those kind of things that can be only included, like that can be only addressed by the cohort studies. So in this, like this study, we had the questions like what is the relationship between the long term consumption. So remember, so long term in our research, we define the long term as a more than 5 years of the main food groups. So there are different food groups. We have analyzed the different, like the whole grains, vegetable, fruit, nuts, so all those things, and cardiovascular mortality among the adults. So this, if you look at the PICO, so here the intervention, I means like all the food groups. So though this is not the intervention studies, but there is the exposure already, the people were taking those foods. So here we are interested among the adults, so already the children are excluded, and we are interested in the long term is defined by our research questions. So only we are we included the study which has the long follow-up, and the outcome was the cardiovascular mortality. So similarly, in another study, like we reviewed the impact of antimicrobial stewardship program on antimicrobial resistance and prescription process in nursing home. So here also our population here is not the individual population. So our population with the nursing homes, so program, so intervention was the antimicrobial stewardship program, and comparison was with nursing home with not having those kind of program, and the outcome was we are trying to look the antimicrobial AMR resistant as well. So, and another was, this was in this study, like we try to synthesize the evidence on effectiveness of intervention to address the transport and other unintentional injuries. So here again, the population is adolescents. So in adolescents also we define the age group and intervention. So here we haven't defined the intervention is already, but inside that we look at all the intervention, what are the intervention they done. So there were the different interventions, sometimes this licensing criteria and other. So we looked at all those intervention, and we see the effect of that on transport and other injuries. And I would like to share that this review already, that this review finding is already included in the Australian nutritional guideline. So I mean, it is on the process of revision, and this review is included. So this kind of systematic, if we conduct the quality systematic review and meta-analysis, then that can impact the like inform the policies as well as for future research as well. Because in this review we have you can go through later and see like we have concluded like that there is no concrete evidence about the intervention. So there is a need to do the further studies in this area. So that are the examples. So there are other studies, I mean, systematic review I'm involved in currently. One is, as I gave an example before, like effectiveness of mobile health intervention for management of cardiovascular disease in South Asian context. So where I was not interested to app-based intervention, because I'm thinking about more in the low middle income country context. And another is the effect of lifestyle intervention in midlife in reducing. I'm working in the cardiovascular disease and NCD, so mostly my research is also focused on that. And this review, effect of beverage consumption and cardiovascular mortality, is already done, and it's like the I mean, manuscript is also ready. And this is just started, like with my mentee and other my students are included in this review. So this is the mixed methods review on looking at the evidences on antibiotic AMR resistant in LMIC context. So these are my experiences, and I have written a blog in Authorate. I think I have shared before as well. So here, this is just a simple blog where I have provided different link, like what kind of review, whether it's scoping or systematic review, or the systematic review and meta analysis can be done. So there are the link also included, so you can go through there and see. And for the further research, my main reference was the Cochrane handbook, especially the chapter 2 for this talk, and also I refer the JBI systematic. So there also you can go, and they have the whole manual of doing the systematic review and the scoping review. And Coursera also has online course, and some of the university library site has this framework, Pico, Spider, Eclipse. So they have this framework as well. So I refer them in this presentation as well. So you can, for further information, you can go there and see. So this is my contact information if like we need to discuss after this session as well. Yes, thank you so much. Here I come to end of my presentation. So if there are, I'm sure there are questions. So let's have a question answer session. I mean, okay. Ifoma, yes, please go ahead. Sorry if Nancy, if I haven't pronounced your name correctly. Okay, I'm looking at the chat at the same time if there is any questions. Nancy? Okay.
Okay. Hello.
Yes, I can hear now.
Okay. Thank you very much for your presentation. I have two questions. One is, when you talk about mixed methods, can you explain further what you mean by mixed methods? From the discussion, setting framework can be used in these methods, while others are qualitative or other quantitative. If you can explain that. And secondly, I wanted to ask, how many research questions can a particular systematic review answer at a time per study? Like these papers that you published, like the 3 of them that were published, how many research questions did you answer? They answered just one, or they answered more than one? And is it allowed that a particular systematic review can answer more than one research question per study? I hope I'm very clear. Thank you.
Okay. Thank you, Nancy. For your voice was breaking, but as far as I heard, I think you have one like how you decide the mixed methods, design or study, and another was how many research questions like we can use, right? If not, then yeah, please ask again. So first of all, like the mixed method, usually in a systematic review, like if you are doing like your research questions, you want to address the quantitative. What is the improvement? What like, for example, I showed you like in my study, it was mostly like my published study are mostly the quantitative kind of like, especially focus on the intervention design, like what is the effectiveness, what is the improvement, like the reduction of the blood pressure or the how much like the cardiovascular mortality would be higher. So that would be focused on the usually quantitative study or the intervention study. So in mixed method, you would not only interested about non what or the which kind of thing, but also the how, why, if like there is more percentage, then why, or if the something is effective, then how. So for that, your review will include if your questions also focus on the mixed method kind of, means like you have the quantitative and qualitative both questions is there, then you have to include those kind of studies which can address those research questions. Like if you are talking about the experience of how like the what is the perspective of some patient or the healthcare provider or something like that, and then or experiences, lived experience or something. So if you want to study on that, and if you include only the quantitative approach, then it might not be justified. So that is approach, like the mixed method is like the, if you have the qualitative and quantitative, and at the end, like you want to synthesize both, you know. In the mixed method research also you do the same, and systematic review as well. You have the quantitative like the result synthesis and qualitative, and then you do the triangulation, like based on that, like the quantitative finding shows this, and the reason are that given by the qualitative, or the qualitative has not agreed on this. So that kind of thing is the mixed method. I hope I can answer. I answered your questions. I mean, I did not heard like your voice was breaking, so full question I might miss. So another one, how many research questions? So there is no hard and fast rule for how many, but based on my experience, yes, of course, you would have one broad research questions, and under that, like you can have the individual, like as I showed you my like first paper, like long-term consumption of food groups. So there we have the 7 food groups, you know, like there is the already the 7, so like the what is the effect, long-term effect of whole grain on cardiovascular mortality, what is the long-term effect of red meat intake and cardiovascular mortality. But that is like one broad aspect is that, and under that also we had a specific research question. We are interested in see the stratified based on the gender. Okay, what is the impact among male? What is the impact among female? So we can do, if it is related, then you can have more than one. But I would suggest don't go with in systematic review, don't go with a unrelated research question, too many research questions. I mean, broad one and subgroup like a general and specific. Here we don't talk about general and specific, but broad research question 1, and under that you can do the subgroup analysis. But if you have too many research questions, then it cannot be justified by one single systematic review. So that because I can give you an example, because we also try to, in the beginning in our research, we try to do the systematic review with food groups and consumption of beverage with cardiovascular mortality. But we realized during the proposal development phase, it would be too much. That's why we separated them into 2. We did not do together. I mean, it would be too much to do the systematic review in one, and it would be confusing, and like even it would not fit in within one manuscript. So we had the separate one with the food groups with cardiovascular mortality, and one with the beverage consumption like alcohol, tea, coffee consumption, and cardiovascular mortality. Okay, yeah, thank you from my side. So next, Oscar. So should I can see some questions in screen share. So are these questions for me from the chat box?
Hello.
Uh,
Thank you very much. This is Oscar on the line. Thank you
Okay.
very much for your presentation. And my question is quite similar to, oh, the question has changed. I want to find out, in your opinion, if I'm conducting case control study or a cross-sectional study, what framework do you think will be appropriate?
Sorry, case control or cross-sectional studies?
Yes, what framework do you think is appropriate?
So it depends on, as I said, like here also we.
Now, if my focus is on quantitative study.
Yeah, so yes, of course, because focus is in the quantitative study, like what you want to see, you know, like as I said before as well, like we do not say like the here in PICO, we are seeing the intervention. That's why we need an intervention design. So here, like in what is your research question or objective? So I think even so in a cross, can you just give an example, like what is your interest, like I mean in a quantitative, then we can be more clear, I think.
Something like the looking at the impact of multi-drug therapy on the socioeconomic situations of those suffering from neglected tropical diseases. So we have been giving them drugs, so we want to see their socioeconomic.
So I feel that, yeah, okay, based on this, I feel that the PICO framework fit in that design, because your population is the, I think, population TB patient. So you are seeing the intervention is the multi-drug therapy, and you are comparing who have not.
Yes, please.
And your outcome would be the impact. So here you have to define what impact you want to see, but because here also, though it is not the intervention design, but you are looking at the impact of the intervention. So and one more thing, I mean, just in my head, so but it is very difficult to see the impact and intervention through the case control study or the cross-sectional study. So that also, I mean, you have to look into it. But of course, if there is just a evaluation, cross-sectional evaluation, then your question would fit in the PICO at this stage. I mean, based on the preliminary
Okay.
idea. Okay,
Thank you very much.
Thank you. So, Davidson, I can see your hand. Do you have any question, Davidson? If not,
Thank you very much. I don't really have any question, but I missed your contact slide. Please, you showed your contact. Please, I wish to get a contact.
okay. I hope Fortune or SRM team would share the slide, and there is contact details, my contact details. Thank you, Davidson. But one more thing I would also clarify, because I'm very poor in responding emails, because it's not like I don't want to respond, but you know, there is sometimes like the lots of email and I feel very difficult to manage time. But of course, though late, I would get back to you, like if it's important question. Yes, thank you. Angela?
Hello, Buna ma'am. Thank you for the wonderful presentation. My question is not very specifically research related, but is very general. So as I am an early career researcher and I'm interested in systematic review and meta-analysis, what research topics or areas or any kind of frameworks would you suggest that would be a quite good start for people like me? Okay,
thank you, Angela. And okay, I'm not sure at what stage you are. I mean, early career, like you are studying, or I mean, you already finished the study. But my suggestion would be for the early career researcher, or if you are a student, or if you just finished you just graduated, but you don't know where to start, I would suggest to have a team. I mean, you can collaborate with, because I think my last talk, I talk about the how to form a team and how to start. If because it's very difficult sometimes to know the gap and do the systematic review alone. So you can collaborate with the experts, I mean, who are doing the systematic review, and in the beginning you can collaborate with them. Sometimes for me, like if like I'm in academia and sometimes my student like sort similar kind of interest, and at the beginning, I try to include them in my review team so that they will learn the process and they will understand the process as well. But if you want to independently start, because for the systematic review, you know, there should be the methodological expert, there should be the content expert, and yes, of course, like the early career research also can should be there. So you can form a team and discuss within a team and go ahead, and yeah, the other process would be the same, like the identifying the gap and forming the research question. But I would suggest contact some of the expert and include with them. Yeah, thank you. Hope it helps to you. Okay, thank you, Angela. And Abe, should I mean, I can see the raised hand, so I'm taking those questions. So I think I can come back to this screen question later. So Abe, sorry, I'm very poor in pronunciation.
Okay, thank you very much for the presentation. And you know, I have a question that you have touched partly upon, and I was asking, can we address more than one research questions in a given or a single meta-analysis? And you have addressed partly, but in meta-analysis, we have a PRISMA guideline, you know. So are we going to have multiple PRISMA guidelines if we are addressing also related different number of questions in a meta-analysis? How do we address? For example, if I want to assess risk factors associated with certain single outcome, risk factors can be multiple in number. So if I go for single PRISMA guideline, I'm going to exclude some of the studies which do not have all the risk factors together. And then how can we address these kind of things, please? Thank you.
Thank you. I understand your question very well. So in this context, I think in one meta-analysis, you can address one specific questions, but in PRISMA guideline, there is no like, you have one Prisma guideline, but your objective would be the different. So in this case, what I see is like, if you have different risk factor, then you will do the meta-analysis of the different, because one Prisma guideline can incorporate all the things, but what is the difference is in your analysis, you will have the meta-analysis of individual outcome, like obesity and something like the risk factor, hypertension and outcome, because that's what we did in our like long-term food intake study. Like we did whole grain intake and cardiovascular mortality meta-analysis, and we did fruits intake and cardiovascular meta-analysis, but it can fit, your objective can fit within the Prisma guideline, but your specific thing in one meta-analysis, you can only use one objective. But in your one systematic review, you can have a different meta-analysis as well. Like if you do the risk factor, then also you might want to see the subgroup analysis, like what is the risk is among adults or the children. So that flexibility you can have in the Prisma guideline. It would not restrict you if it is within the same framework. Yes. Thank you. Armstrong.
Hello.
Okay. Yes. Please go ahead.
Okay. Thank you for the presentation. Kindly explain the SPICE framework again. I want to differentiate it. I want to know how to differentiate it between from Eclipse.
Okay. So, as I mentioned before, like that there are some similarities, similarities and the differences. So it's not like the exclusive, as I mentioned, like if you talk about the setting, like SPICE talk about the setting, so it comes with the context is also the setting, So SPICE is like a one frame. If you are using SPICE, then you have to fit your concept within that framework. But if you are using the Eclipse, then in Eclipse also like as I mentioned, like sample and the population would be, like the perspective of the population. Like in SPICE, we talk the perspective. So perspective of who means the teenager. So in PICO also, the population is the P is the population. So I mean, it is not exclusive, but it is more what you call the in-depth. That's what I can say at this stage. So because setting, SPICE talk about the setting, perspective, intervention, comparison, and evaluation as well. Because evaluation in terms of like how you are going to evaluate on the effect of this some intervention means evaluation of the successful attempt to give up smoking or success. What is your interest? So I think like if it is more in depth, I would say. Why in depth is because you have to develop search strategy based on all these concepts, 5 concepts. So yeah, you can decide, I mean, which framework would be more appropriate in your research objective or the questions. Yeah, so I would not say exclusive, but some is different, like the intervention focus in PICO, like PICO doesn't talk about the evaluation or something, but outcome is there. So yeah, that's what I can say. This is it.
Thank you very much.
Hope it clarify your concern. And yes. I don't know who raised the hand before, but I can see the Dr. Debris too.
Okay. Are you hearing me?
Yes.
Okay, thank you very much. Thank you for your interesting presentation and sharing your experience. My question is, it's clear that PICO statement can be created, or PICO statement can be used for systematic reviews based on randomized controlled trial studies. But how can we create a PICO or use PICO framework for the systematic reviews based on cross-sectional studies?
So that's, I think, because why PICO is more interested about the intervention. So that's why, like, yeah. I talked about, because how the intervention is done is usually using the intervention design. In intervention design, there are different kind of intervention, you know, like it could be randomized, non-randomized, quasi-experimental, pre-post. And why we use the randomized control trial is, if you see the hierarchy of the evidence, because randomized control trial will give the highest quality of evidence of any intervention. That's why you want to include the randomized control trial. But the thing is, the previous speaker, I forgot the name, he talked about the impact of some intervention. So that's what my question is, how the cross-sectional study can see the impact of intervention. There could be some intervention design, you know. So, I mean, if you are trying to see the effectiveness of intervention, then in PICO, you cannot use other design, because effectiveness can only be found on the intervention design. So that's my concern is, so if intervention, so yeah, I mean, impact of intervention of multi-drug therapy, like the previous speaker example, so that I doubt that can be done in the cross-sectional design as well. Yeah. Okay, is it clear? Because that's the thing, design, your research questions will determine the design as well, you know. So yeah, thank you. So Ahunam, yeah, you can go ahead and
Thank you for the class. So I would like to ask 2 questions. First of all, I want to know if you get to choose your framework before creating your eligibility criteria, or you like bring out all the exclusion criteria, inclusion criteria before deciding that, oh, this is the framework that fits in your study. That is the first one. Then the second question is, say you want to carry out a systematic review on a particular technique, like for diagnosing a particular disease. Which framework would fit that kind of study? And then when you're trying to carry out this review on a technique, would you be focusing on effectiveness or accuracy, or is it just the systematic review on its own? Can you do a systematic review without having knowledge on the particular technique used for the diagnosis?
Okay, thank you. So I think I understand your question partly, but yeah, you can add in between. So first of all, having inclusion and exclusion criteria before deciding the framework, because you will decide your inclusion and exclusion criteria based on objectives. And your objective, usually we suggest to have some framework while designing your research questions. So I wonder, like, how you decide the eligibility criteria without knowing your research questions or objectives. So that would be my concern. But having said that, sometime during the process, you can you have some framework and you decide the eligibility criteria or something like that. And when you like the source, the literature, and you said, oh no, only not only the intervention, I want to do the other study included, other type of study can also include. So you can go back and forth in that, because there is a flexibility in systematic review. Like that's why in Prospero, if you register your proposal, then there is a scope of updating your proposal as well. But in the beginning, I think without having a research question, I think it's difficult, because eligibility criteria depend on your research questions, like among whom, what you want to study, and what are the outcome you want to see. And then you will know what kind of design can address that outcome. As already I mentioned, like if experiences, quality, like the lived experience or perception, expectation, then you would think about, if your objective is that, then only you think about the design. So I mean, objective will guide your methods. That can I say. And other one, I was not very clear, but I'm trying to answer based on my understanding. So I think if you want to study about some devices, diagnostic devices, whether, I mean, your question was whether to focus on efficacy or effectiveness or something like that. So if that is your question, then what I would say is, it's not you decide. So it's what your gap is, what evidence you, whether there is a need to see the effectiveness or efficiency. So during your preliminary, that's why in the beginning, when I talk about the research idea generation, there you would know, like, whether you have to look at the efficiency or the effectiveness or the feasibility, sometimes cost effectiveness. So that would be guided by the literature. So we cannot say, without going through in detail, like we should focus in this area. So yeah, your literature will guide that aspect. Thank you. Josephine. Yes.
Yes, thank you, Buna, for that insightful presentation. My question is simple. I just want to know, are there key elements if I'm developing or constructing my systematic review title? Are there key elements I have to include in that title, or it's not really very crucial? Okay, I just want to know whether there are key elements I have to include or I shouldn't miss in my systematic review title. Thank you.
Yes, because this concept, what we talked about in the research questions, that concept should be reflected in your title. And sometimes, like this design aspect and these things cannot be reflected in study design aspect, cannot be reflected in your research question, but that should be reflected in your title. For example, effectiveness, I mean, of something, like what if it is an intervention, like among which group, like population, and where, and if, I mean, not always necessary, but sometimes we also like to see the evidence in like systematic review of the cross-sectional studies or the cohort study. If you, that is not the compulsory thing, but population, your outcome, or like what you want to look at it, and the where you want to do it, if it is a global or the focus on the particular region, like the African context or the all the LMIC context. So that should be reflected in your title. It should be self-explanatory. And because in research and systematic review also, title should be related to an objective and research question, and that should also related to your methods. I mean, that research question in method, you will address how you are going to answer those research questions. So these all are interrelated and it's self-explanatory. You can't like just write the systematic review title like systematic review on cardiovascular mortality. So that would not be complete title. So it should be complete, but not too lengthy. Yeah, this four concepts should be there. Yeah. Thank you. Okay, I cannot see any hand raised now. So are there other questions? I saw before there was the question in the screen. Fortune, is there any other question in the chat box? Because I'm not following that. Okay. Are these the question? I can't hear. I assume so. Okay. So the first question is, the PICO is suitable for study that must include population. What about the formulation research question for other study that not including the population? So I showed one example. So population is a group. So sometime, like your population could be the organization as well. Because there would be the population. I mean, population in terms, you will do the study about something. But if it does not fit in the PICO, then it's not like you have to use the PICO always. So if you are doing the intervention study, seeing the effectiveness, I'm sure there must be some population. But if it is not, maybe it doesn't fit in the PICO criteria. But there is a sample or other framework also you can think about it. But I as for my understanding, there is some context. If there is not population, maybe there is some context. So you can use other framework. Yeah. So next is, how can we state a PICO statement for the cross-sectional study based on systematic review? So this question is a little confusing. I think we not based on best systematic. Oh, cross-sectional studies based systematic review. Yes, as I think I answered this question. So question was to see the effectiveness impact of the intervention. So in that case, impact of intervention, I mean, intervention is there. So, but I doubt whether the cross-sectional study can see the impact of the intervention. So that's the thing. So that's why, like, your research question will decide the design. So I don't know, like, the cross-sectional study can see the impact of intervention or not. So that's things. And another one is the following the final if they were not this. Oh, okay. So because why the ethical, can the ethical part be made by using study data of an ethical claims by ethical review? Yes, of course. So sorry, because I thought it's well understood, and usually while doing the systematic review, we don't need to go through the ethical approval process. I mean, it doesn't require, because we are not dealing about the individual human being, but we are dealing with we assume that all the studies which we included gone through the ethical approval process. So that can, I mean, that is a very good question. I mean, while reviewing the doing the risk of bias or reviewing the quality of the study, we should see whether they have done the ethical, they have followed the ethical process or not. So if you included, you can still justify it, because you are not violating the ethics there, because they have done already, but you can raise that issue in your review, or as a researcher you can exclude them as well, because you don't want to include the unethical study in your review. So that's the thing. But thank you, you raised very important questions, and we missed to discuss that. So can someone still use PICO framework when there is no comparison in the design, but other parts are included? If there is no comparison, then C would not be there. So it would not call the PICO, maybe the PCC or something, other framework. If there is no comparison, then we can't say that it's a PICO. Yeah. And which framework is for exploration study? So yes, here, you know, like your objective, exploration studies, what is your objectives, what you want to see. So based on that, we can decide the framework, not the based on the design. Even in RCT, please let's not be confused with this. Oh, sorry, my confused with this, because even in RCT, like if you want to see the what perspective about the intervention, perspective of the people who are included in the randomized controlled trial. So in that time also the PICO framework might not fit. So it depends on the what you want to study. So because why we are saying in PICO the randomized controlled trial is the intervention is there, that's why RCT is considered. But your objective will decide the framework. It's not like the design will decide your framework. And again, and wish to differentiate from, I think this is answered already. We answered this. So spice and eclipse. I think if that is all the questions.
Hello, Dr. Buna.
Okay.
Yeah, someone has a question here, please.
Sorry. Oh, raising.
Yes, thanks very much. I was wondering, before publishing my protocol, do I need to include those frameworks I have used, or Prospero or any other publisher will tell the framework?
So your question is, while publishing your protocol paper, do you have to include those framework? Was that your question?
Yes, put it in details that PICO population this, or they will read my title and tell.
Yeah, because like if you are publishing a paper in Prospero also these days, like due to the loss of submission, they are not reviewing or getting back on time with lots of comment, but your reviewer will go through that, and if you use some of the framework, it would strengthen your study, and even publication of paper, like it is like a scientific process. So, and it will help to clarify your approach, and it will help the researcher to frame the research strategy and all those things. So it's better if your questions fit in those framework. But I would also like to clarify, it's not compulsory you have to always use, because it's like using a theory in your research, some model. It is better, sometimes it's better, like it will guide you. This framework are meant to guide you, not to confuse the researcher. So sometimes if you feel none of the framework fit in your research, then you can justify that and go ahead. Yeah. Thank you. And one question I saw in the chat box, like how many papers should I include? It is not up to us. It up to the, based on your eligibility criteria, how many paper will be searched and included after the first full text review. So that up to the available literature, but usually minimum should be 2, we say. But I mean, some of the paper, if there is like the scarcity in the resource, like the literature, and if it is very interesting area or the need to have those kind of evidence, then even there are papers which has included only 2 papers. But it's not we decide how many paper, it's the decision, like after you sort all the database and how many paper fit in your inclusion criteria, you should include all of them. Yeah. And I saw one question, when you pull data from 4 database for analysis, is this a meta-analysis or integrative data analysis? I am a little confused about the question, but I'm trying to answer, because in systematic review, you pull the database from the studies from different database. That is the process. If you are not searching the studies in one particular database. So for meta-analysis, I mean, meta-analysis is the synthesis of the evidence. It doesn't care about the how many database data set. When you pull data from 4 data set for analysis. So this is confusing, because usually data set in meta-analysis, you will have, in systematic review, you first include the study and extract the data from those studies, individual study. There would be the data from the each individual study, and you will pull those data in the meta-analysis. So maybe data set, I am not understanding clearly what the question he or she is asking. Okay, so do we have to register research questions? Not the research question, but the protocol of systematic review you have to register. But in the scoping review in JBI side, they register the title as well. So yeah, title registration system is there. Okay, I think I talked a lot. More than, yeah.
Thank you very much. Thank you very much, Dr. Buna. Please do you have a final words for us before we end the session?
From my side?
Yes.
Okay. I mean, I'm very grateful to the organizing committee for designing such a wonderful session, and I can see there is around 300 participants, and providing such kind of training with this large group of researchers is a very wonderful opportunity. And one more thing, like this researcher, what I would suggest is systematic review team can be formed within this hub as well. So next step could be within this hub, like who has the different, I think there are the hands-on session as well, and everyone has some of the research questions or some title in mind, or they are working on that. So if they form some kind of group within from this training session and have some proposal, and I think within a year, I think they can have a review paper as well, or they can do a review. So that would be my suggestion. But yeah, I'm very thankful I could share my thought in this platform. Yes, thank you so much, and good luck for the rest of the work, sir.
Thank you very much, Dr. Buna, and thank you everybody for being with us up to this time. We have shared the quiz for Dr. Buna's session through email, and we've also shared a form, and that form is for you to register a clearly defined research question and topic we are giving to you tomorrow. So you have, well, we have till tomorrow to think of a good systematic review topic and research question. So what we may potentially do might be to pick like 3 or few of those topics and give some kind of open feedback tomorrow. So you'd see where you could, work on an amend. And what we think is that, like Dr. Buna has said, you might want to form systematic review teams and start working on your systematic reviews. So we have a WhatsApp community, and sometimes it's easy to get collaborators from there. And even our AuthorHate community platform, it's easy to get, so we would share the AuthorHate community platform. It's easy to get collaborators from there. You just share your research topic or your field of interest, and people that are interested to work with you, they will always indicate.
Okay,
So we
bye-bye.
also have a question box. We cannot take all the questions. So some of the questions you can send it there, and we will try as much as possible to respond to some of them.
Okay, bye-bye, everyone. Good luck.
Yeah, thank you very much. That'll be all. See you in 1 hour time for the last session for today. Yeah, you can clap.